Hello, everyone. Welcome to COVID Corner. I'm Tony Leon, your host. This is the place where you'll be enlightened, encouraged, and empowered to take back your health during this pandemic worldwide crisis. We're going to get right into our program, but before we do, I'd like for you all to consider subscribing and hitting that notification bell if you haven't. I'd like for you to like, share, and comment. And let me focus on share. See that symbol? That little arrow? When you see that on this YouTube video, please copy that link and share it with all your contacts, social media, what have you, because this is very important. And I'm trying to share this with as many people as possible because time is running out. We're in a crisis. And today's title is Vaccines, Variants, Omicron, the Good, the Bad, and the Ugly. And this is basically you getting the other side that you haven't heard. Most of this information is basically going to be me conveying what other authorities have went over, but me dissecting it and telling it in such a way where it creates this narrative of, oh, I didn't know that. So check this out. Vaccines in the news. We're going to go over some articles. This first one right here is Johnson & Johnson COVID-19 vaccine recipients often shift to other boosters. Now, this one right here was from the Wall Street Journal. And this was in November 26th, of course, just happened, 2021. I want to kind of go over this, but when I do, I want you all to pay attention because they're shifting. We're going to see why are they shifting. It's like I said, it's a narrative, and I want to go over it, and I want you all to see what's happening in the news. So right here it says, most people originally vaccinated with J&J shot are choosing other vaccines if they get a booster. New government data show partly reflecting concerns about the lower effectiveness of the drug maker's vaccine. Lower effectiveness of the drug maker's vaccine. Now, this is what they say. I'm going to continue to read, but I want you all to understand something. Now, so far, about 1.7 million people of the 15.7 million who originally got J&J's single-dose vaccine have received a booster. Of these, 26% stayed with J&J, so quite a bit, one quarter, for their second dose through Wednesday, according to U.S. Centers for Disease Control and Prevention. So that's the CDC, according to them. Then it says the rest of those originally immunized with J&J's shot later got boosters, received other drug makers' vaccines. Some, 43%, got Moderna. And 31% received boosters from Pfizer. Okay, now I want to explain my experience when I first got my shot. Okay, I got the J&J. But the experience was kind of weird. And I think I kind of see what's kind of going on here. So when we first heard that J&J was available to everybody, I'm not talking about the booster, the regular J&J single dose shot. I got word from my sister and her husband about, hey, it's available, and I'm looking at, okay, let me try to find one. So as I was looking, when we were going to like CVS and Walgreens and Walmart, we started realizing they were offering Pfizer, Moderna, no J&J. It wasn't readily accessible. So we had to keep digging, ask and it shall be given you, seeking shall find, knocking the door shall be open. So that's what we had to do. And you know me, I'm the type of person, I'm not just going to just let something go and just go with whatever is available. I'm looking for what I want. I was looking for the J&J, me and my wife. So we finally found a place that had it. So we had made appointments for the Pfizer and the Moderna, and we had to basically just cancel those appointments because we really wanted the J&J. And it was a convention center not too far away from here. And there were thousands of people, okay? I mean, I guess they had it laid out. And it was the National Guard out there, administering it and stuff like that. So what happened was they were offering also Moderna, but no one was really going for the Moderna. They were going for the J&J. And not to put race on it, but most of them were Caucasian, white. And you had some other nationalities in there and a few black. So we're in line waiting for our, J&J, and we finally got it. And I'm looking at what kind of experience should I receive, like what type of adverse reaction if there are going to be any. And this is what I've noticed. I noticed, like, not right away, but like a little later on, I think that same day, I felt a little fatigue. Like you're about to come down with something. Like, I guess it was like a 24-hour bug, because that's exactly how long it lasted. It was over with in around 24 hours. And I noticed there's some similar reports from other people. So no big deal, But this is what I heard. People, if you got the mRNA, now remember, we have 3 vaccines out there, 2 types of vaccines, but 3 companies. You have the mRNA, that's the messenger RNA, and you also have the adenovirus vector, which is the J&J, okay? 3 companies, but there are 2 types of vaccines. So if the people were getting the vaccines, the mRNA, and this is what the CDC said, they said, if you get these adverse reactions, I'm talking about like the severe adverse reactions from your first administered dose, do not get a second dose. I remember that. And I was like, whoa, so I guess be prepared for that, because, that's some good advice. You don't want to get the second dose if you get some adverse reactions. But I noticed that there were people, that I met, like, restaurant owners and stuff like that. They got the Moderna. First dose, no problem. But they got the second dose and they had the problems. They felt like they wanted to die. It was like terrible. That's what they tell me. And I was like, wow. So I've been hearing similar reports about the Moderna. And I was like, whoa. So, I guess you got to be careful, because when you get your first dose with the Moderna, it's like 4 weeks later, 28 days later, you get your second dose. And it was like very little room for error. You have to take it then. That's what they say. That's what the Moderna people say. Pfizer, a little different. After 3 weeks, that's 21 days, you take your second dose. And they had a little grace about 4 days. So that's how it works with the mRNA. And this is what pretty much every vaccine does. What you call elicits, that's ELICIT, elicit, that's mean to get an immune response. Okay? So when you get the vaccines, all of them, what's happening is your body goes into this rush mode of production of antibodies. And these antibodies are basically there to code and to be able to identify the so-called spike proteins and so forth of the coronavirus. Good. But what's happening is some, or should I say, they all have what you call a waning. Okay, keep that in mind. Waning meaning the waning of the antibody production. Some more than others. But as I continue to read this, I want you all to understand something. The rest of those originally immunized with J&J shot and later got boosters received other drug makers' vaccines. Like I just said, 43% for Moderna, 31% from Pfizer. And we got the J&J, just to let you know, that's the first one. But then later on, we got the J&J booster. But it wasn't a walk in the park. Again, we had to ask, and it shall be given us. Seeking, shall find. Knocking, the door shall be open. So we're looking again, where can we get the J&J booster? So we're checking the CDC site, and it's not readily available. And my brother-in-law and different people were like, where is it at? And I'm like, I don't know. I'm trying to check it out myself, and it wasn't just readily available. And then I did a Google search, and I said, where is the J&J available? And then they said Walmart and Sam's Club. So I was like, okay. So I called Walmart Pharmacy, and they had it available through the prompts to set up an appointment to get your J&J, because not every Walmart has the J&J. It's still like this. When you call, I want to set up an appointment to get my booster. They say, okay, we have the Pfizer. We have the Moderna. They always do that. So I said, okay, I want the J&J. And they set up the appointment, and they gave me the specific Walmart that had it. Okay, moving ahead. We get to the Walmart, And there were a lot of people in line to get their booster shots. But we noticed that there were people in line who got the J&J shot, like the couples and stuff. And then they're telling us, oh, yeah, we're here to get our booster shot. And so what you getting? Oh, we're getting the Pfizer. So that's what they tell us. We're getting the Pfizer. Okay. And I said, oh, we're getting J&J. They're like, we didn't know J&J was available. Yeah. Because a lot of people, they get pushed into getting the Pfizer or getting the Moderna. So it made me wonder why they said because of the lower effectiveness of the drug maker's vaccine. It kind of sounds like maybe that's all that became available because it wasn't easy to find it. Well, anyway, we got the booster. Oh, real quick, I want to tell you my experience with my second shot, which is the booster. So I get the shot. Before I get the shot, I'm letting the guy know. I said, hey, is there any type of adverse reaction I should expect? I mean, and then he tells me, he says, well, it said that it's more pronounced with your second shot. I was like, oh. So I'm thinking to myself, like, okay, give it to me. I need it. So he gives it to me. And it was kind of like, it wasn't, let me tell you the effects. Because, he gave me the shot. Okay, it was done. But the effects, I didn't feel that fatigue and all that other kind of stuff. And I was thinking like, okay, did I get a shot? Was it water or whatever? But I noticed a difference in how I felt. I felt more energetic, more like a energy type of thing. I said, is that normal for you to feel energy and stuff after getting vaccinated? I don't know, but I took advantage of it. So I was doing more push-ups and stuff like that. But there was no adverse reactions for my booster. So I was like, that's good. Okay. But I noticed that a lot of people, and even my wife experienced this. One of the girls in line, she wanted to get the J&J too, but she didn't know it was available. And then my wife kind of hipped her to it. So now she's going to get the J&J. It's only basically either about word of mouth, or if you just that type of person say, I'm going to seek, I'm going to ask, and I'm going to knock, and I'm going to get it. Because not an average person going to do that. Now they're talking about people can mix and match. And I'm thinking about, okay, the mixing and matching, that kind of made me think about, okay, you have Pfizer, Moderna. They're similar because they're the mRNA. But if you mix and match with those, it seemed like, okay, it's the same product for the most part. But J&J, like I said, these people are going from J&J to Pfizer, Moderna. And I'm like, okay, is that okay? I mean, I guess they say it's okay, but I'm thinking, if J&J's booster shot is available, why wouldn't you just stick with the J&J? That's what I'm thinking. Okay, so here you have a J&J spokesperson. He says, the company's vaccine provides protection against symptomatic COVID-19, both as a single dose for an efficient response to the pandemic and as a booster dose. So they know their product. And I'm looking at it like, okay, why aren't we hearing this? It's not just, they're trying to sell a product. They're letting you know, hey, we made this as good as a single dose and for booster. Like, that's a really good, efficient way to go. And then, I'm not sure if everyone knows this, but the mRNA, their vaccine, it has to be ultra cold storage. You have to get 2 shots. Like I said, the Moderna, the first shot, then the second shot 28 days later. And there's no room for error. That's what I'm hearing. And then the Pfizer, 21 days later after the first dose. And then you have maybe a 4-day grace. Okay. But if you get the first dose and you get these crazy adverse reactions, do not get the second dose. That's what they said. But I'm hearing people who getting the first dose, no problem. But the second dose, and there's a problem. So, like I asked that one lady, the restaurant owner, I said, oh, so you had those reactions after the second dose? They said, yeah, I felt like I was going to die, Tony. Oh, it was terrible. I said, oh, you're going to get the booster? And she looked at me like, I don't know. So I'm hearing that people who got the Moderna, maybe they could go with the J&J or the Pfizer. It depends, I guess, on your situation. But I am hearing that there are a lot of different reactions from different people with not just one vaccine. There are 3 different vaccines out there, but there's 2 types, like I said. Okay, moving on. The preference for the latter shot was based in part on an unpublished study that compared boosting with various vaccines. The UK government didn't share the details of the study, but said the research provided good evidence that the Pfizer shot would provide a stronger booster response. You know, that's what they said. But I caught that. This was all based upon, or should I say in part, based upon an unpublished study. So I'm looking at, okay, where's your reference? Where you getting it from? I mean, you know, is this valid? Or do we just have to take it as holy writ, so to speak? And I'm thinking like, that's kind of like fruit of the poisonous tree, so to speak. You know, like you just injected some information and you don't have a reference, or no, you can't cite it because it's unpublished. And, oh, it's good. You can go with the Pfizer. The Pfizer's good. I mean, y'all had the AstraZeneca. I know y'all heard of AstraZeneca, okay? That's the other vaccine. Like you have the J&J is the adenovirus vector. AstraZeneca, adenovirus vector. But the thing is, they're from different sources. I'm not going to get into it right now, little bit later, but the AstraZeneca is in the UK. I would think they would be promoting their own kind. I don't know. I just thought about that. Okay, but getting back to that later. So it says the booster shots are intended to address waning immunity conferred by the original vaccines and to shore up protection from the highly contagious Delta variant of the coronavirus. Okay. Now, all vaccines have what you call a waning, meaning they go into your system, take some time to produce these antibodies. Okay. Now your immune system's on high alert. And basically they're coding for the baddies, you know, the coronavirus, to make sure that they can go ahead and have a fair shot at this thing. Because I look at it as this. When you get vaccinated, it's basically putting time on your side, as opposed to if you weren't vaccinated, time is not really on your side. Now you got to rely heavily on, or should I say solely, on your own immunity. And if your immunity is not up to par, time works against you. I've even heard of health gurus who weren't vaccinated and then they succumb to the virus and die. Yeah. Health gurus. I'm talking about healthier than me, like fit. So it just depends on your constitution. The vaccines put time on your side. All of them. Okay. So I'm not talking against one or the other or boosting one over the other right now. But later on, as we go through these documents, we're going to kind of see that the narrative is there. So if you look at this Delta variant, I noticed that when we had the novel, it was bad for all of us because, you know, we didn't have the vaccines. I was talking about all kinds of stuff prior to the vaccines. Okay. Now that we have vaccines, it gives you a level of protection that is kind of really good. I hate to say that, it just is. But what's happening is when you get the vaccine, yeah, there's a waning. I get that. But it's also a level of protection against these other variants, especially when you get boosted. When I first heard about the Delta variant, but first of all, before the Delta variant, I said, you know what? America, at the time when we had 200,000 deaths, I said, I see 600,000 easily. I saw that. And I was like, wow, that's about the same number that we had back in 1918 with the Spanish flu pandemic. I said, I see 600,000. Okay, we passed that. We're at 800 plus thousand. I heard about the Delta the first time. My wife told me. She said it's taking up about 20% of all COVID cases. That blew me away. I said, oh my goodness, because it's like twice as contagious and twice as virulent. And that means this thing is knocking people out. I was like, oh man. So I'm looking at it like, wow, 20% halfway through the week. I'm looking at the news. We're up to 50+%. 50+% of all new COVID cases. By the end of the week, it was like 93+%. I threw my hands up. I said, I see this in my prediction. I see that we're going to have Americans not at 200,000 deaths, because that's around the time when I first started talking about this. Not 600,000 deaths. I see 1.2 million. And I saw that by the end of March. Now, that was when the Delta came about. Well, you know what happened. Just recently, we got Omicron. And when Omicron is not just 4 times as contagious as Delta, I'm not going to get into the virulent part, but the contagious part, very contagious. Because you know how Delta is. It's like in the lower respiratory area, okay? And you got to cough, sneeze, and things of that nature for it to be like the contagion, and people can contract it, okay? Omicron is different. Omicron is like this. It's in the upper respiratory. That means it's all in the sinuses. That means you can contract it through your nostrils. You can let it off through your nostrils just by breathing. Yeah. Now, y'all probably thinking, just by breathing Omicron? Well, you know what? Don't take my word for it. This past week, we seen it just go skyrocket everywhere. People getting it, and they thinking it's just like the common cold. We're going to go over that because it can be mistaken for the common cold virus. Moving on. The defections, meaning these people going from J&J to other vaccines, the defections from J&J's vaccine might partly reflect studies showing that it is less effective at preventing COVID-19 than the other U.S. authorized shots. I mean, might partly reflect studies. Is this the whole story? That's why I'm giving you all more information on this stuff. I said, I would think not. I think it's basically because it's being widely available. I mean, it's kind of hard to find the J&J. I mean, that's how I'm looking at it. Like when you're trying to get the J&J and then you're offered, here's Pfizer, here's Moderna. People are going to basically go along with it for the most part. I mean, if I wasn't so pushy, I would have probably went with it too. Okay. So it says one CDC study found the effectiveness at preventing COVID-19 hospitalizations in the U.S. was 93% for Moderna, 88% for Pfizer, and 71% for J&J. That was between March and August. Now, this is preventing hospitalizations. I'm not going to get into the numbers specifically right here because I want to show you all, like you can just Google efficacy and effectiveness. Okay. All these clinical trials were based upon efficacy. Okay. In fact, you don't believe me? Watch this. Okay, Google. Define efficacy.
Here's the definition of efficacy. Formal. The ability to produce a desired or intended result.
The ability to produce a desired or intended result. The ability. That means it's able. Okay? But effectiveness. Okay, Google. Define effectiveness.
Here's the definition of effectiveness. The degree to which something is successful in producing a desired result. Success.
Success. Meaning it can and it shall and it's done. That's what effectiveness is. It's effective. Efficacy, no offense, it's more like it has the ability to. Because, you know, when you do your clinicals and stuff, you're like, yeah, it has that ability. But is it effective at producing it? Is it effective at pulling it off? That's what I want to know. So let me finish this report because I want to show you all something, a video. It's not too long, but it's very informative. Okay, so also a study of mixing and matching vaccines showed that J&J recipients' antibody levels would get a bigger boost from either the Moderna or Pfizer BioNTech booster shots than from another J&J dose. Now, that's what they say. Okay, I'm just taking it, what they say. It says the study was sponsored by the National Institute of Allergy and Infectious Diseases. It's almost like I said before, when you get the shot, really any shot, but more specifically the mRNA, it's kind of like it puts your body in a high alert state. It elicits an immune response. That's what it does. And it might kick your body into overdrive for that immunity. You know, here's your B, your T cells, your neutrophils and macrophages and all your lymphocytes, everything is just going high alert. And then the antibody production, and we can code for the virus. So I'm like, bam, that's what it does. But what I'm looking at is if you're eliciting an immune response and that's it, and then you get this waning, you're going to need a booster later on. And that's what is kind of like the thing that's going on right now with the so-called Moderna and the Pfizer. I mean, they don't tell you this part. One single dose of the J&J, this is a fact. One single dose of the J&J, then they say it was 71%. Let's just call it 71%. Is more powerful, more effective than one dose of Moderna or Pfizer. That's not a lie, because you need 2 doses of Moderna and 2 doses of Pfizer to be more effective than 1 dose of the J&J. But now that we have the J&J booster shot, it goes pretty much as high as 90+%. I'm not going to bring that out right here, but that's what they're looking at now. But then you got to get a booster shot for the Moderna and the Pfizer to keep that immunity from waning, if I could put it that way. Yeah. So keep that in mind. You're going to be protected if you get a second dose of the J&J. We know that. I just said that. But you also might get a very strong antibody response if you go ahead and get one of the mRNAs. You might get a very strong antibody response. That's a response. Now remember, I'm not trying to knock the Moderna or the Pfizer, but I'm just saying their focus is eliciting an immune response. And you're going to hear that from time to time. And these are all the experts. That's what it does. Put in a high alert, your body, which is good because you kind of need that. Okay, especially against this pandemic. So what's happening is you have this eliciting this immune response for the Pfizer and the Moderna. And if you get the Moderna or the Pfizer, if you had the J&J, it'll be a stronger antibody response. That may be true just because of the nature of the mRNA. Okay. And it says, referring to the messenger RNA, the key component of both Pfizer and Moderna vaccines. It says Mathai Mammon, head of research and development for J&J's pharmaceutical unit, said it is difficult to draw firm conclusions from the NIAID sponsored study about the J&J's booster. He's trying to back up his booster, hey, it said the study tracked the effect of booster shots on antibody levels, but not on other elements of the immune system that J&J's vaccine might enhance. Did y'all catch that? Enhance. Pfizer and Moderna ain't saying that. They ain't talking about the enhancement of your own immunity. They're talking about boosting your antibody production and getting your immune system on high alert. But remember I said the waning? Well, when J&J's wane, it kind of left you a little special surprise, an enhanced immune system. Now, I'm just saying this is what he said, okay? It says, for us, the data are not mature, he said. So, like I said, you got this in eliciting an immune response with the Pfizer and Moderna. I'm gonna keep saying it. And then you have J&J basically saying, hey, we can enhance. See, the vaccine enhances. So you got the immune system do what it's supposed to be doing, which is supposed to basically fight the baddies on its own when the vaccine is basically waned. Okay, keep that in mind. A separate J&J sponsored study showed that giving a second dose of its vaccine about 2 months, okay, that's 8 weeks, 2 months after the first dose was 94% effective at preventing symptomatic COVID-19 in the U.S. That's mind-blowing because that's what I'm talking about. I'm not talking about just hospitalizations, like preventing the hospitalizations. They said preventing symptomatic COVID-19 in the U.S. I don't know if you all know what that means, but you got them basically saying that Pfizer and Moderna can prevent the hospitalizations and, the death too, prevent the death, but prevent the hospitalizations. Well, let's go one step further. What about preventing symptomatic COVID-19? Pfizer and Moderna ain't saying that. That's what I'm trying to tell y'all. It's like give us the other side of the story. Maybe if you give us that side, then we can make an informed decision on what we would like to use or get, because if yours is about preventing me from being hospitalized, I say, yeah, great. But if you preventing me from getting symptomatic COVID-19, I'm like, I might want that one. That's something to consider. Safety considerations might play a role in booster choices, according to doctors and researchers. A rare but serious blood clotting condition. Now, this is the part that I think we've all been hearing about the J&J. It says a rare but serious blood clotting condition has been reported in a small number of recipients of the J&J vaccine, primarily in women younger than 50. U.S. health authorities say that the benefits of J&J's vaccine outweigh any risk. Let me read that again. U.S. health authorities say that the benefits of J&J's vaccine outweigh any risk, including the clots. But the women under 50 should be aware of the risk as well as the option to get other vaccines. That's fair. I'm looking at, let me know about them clots. Let me know who's at risk. But then if these U.S. health authorities are weighing it all out, it said, hey, it says it outweighs it. Like, let's go with this. It's not a bad thing. And I'm thinking, what health authorities? Because the CDC is not talking about that. And I'm going to show you all some stuff. It's kind of weird. So maybe it's the National Institutes of Health, maybe. I don't know who else is saying it because they're not saying who said this. But maybe they're the smart people and they're thinking, we better put this information out there so people can be aware that, you have other options. If you look at what you have with J&J and you look at what you have with Pfizer and Moderna, you're looking at all the vaccines are good. It's just that there are areas of the vaccine that you need to be concerned with, because when they're talking about this clotting, they're talking about like a thrombosis type of episode, or maybe even more specifically thrombocytopenia. Okay, that's where you're dealing with blood clots and stuff. But what if you're not prone to that? Then you're not really at risk. But I still like to know those risks. So it's good that you put it out there and let people know. Okay, so it says, Dr. Like said, some women might feel more comfortable choosing an mRNA-based shot for their booster because those haven't been associated with the increased risk of the rare clotting condition. And that's fair. I think we need to know that we have options. It says they can have a little more peace of mind if they want to switch to mRNA, she said, if that's the case. But I just told you all earlier, I knew people personally had some adverse reactions and they felt like they wanted to die. So I don't know. It's kind of like, I just want to give you all the good, the bad, and the ugly, and make y'all, y'all can have a more informed decision when y'all choose whatever vaccine you want. It says, conversely, some young men, now this is important, some young men who originally received a Pfizer or Moderna vaccine might choose to get a J&J booster dose because of the mRNA shots have been associated with an elevated risk of heart inflammation conditions, including myocarditis in males under 30 years old, Dr. Light said. And you can ask Google about it. It's basically the inflammation of the inner walls of your heart. That don't sound too good. And if you're at risk because of the effects of the mRNA, you want to have that option to go with J&J. See what I'm saying? So let us hear all the risks. Women, the risk, the men, the risk, and then we can all make an informed decision. It said the U.S. health authorities, I still think that might be the National Institutes of Health. I'm not sure. But it says the U.S. health authorities say any adult 18 years or older who has first vaccinated with J&J single shot should get a booster. of any vaccine at least 2 months later. Okay. They have also said that any adult who received the original 2 doses of either the Pfizer or Moderna vaccines may get a booster at least 6 months after the second dose. Okay. So let's keep that in mind. But this was talking about people are shifting from J&J over to other vaccines, okay, like the mRNA. But I was saying, why? So look at this.